Did you notice in today's modern world there is a pandemic of dementia all around the world? And one of probably really interesting reason why you have all those dementia, of course, is going to be using chemical medication for the years. My name is Mario. I am a European medical expert with 26 years experience working with the patients. And I'm going to give you 7 scientifically proven chemical medication that are connected with dementia. First is going to be first generation of antihistamines. The first group includes older allergy medicines like the diphenhydramine, commonly sold as Benadryl, and chlorpheniramine. Many people use those medications for allergy, colds, itching or sleep because they are available without prescription and people often assume they are harmless. But those medications can really affect our brain. This means they can block acetylcholine, a chemical messenger that plays a major role in attention, learning, and the formation of new memories. In an older person, even a normal dose may cause sleepiness, blurred vision, constipation, poor balance, confusion, and a short-term memory loss. Chemical medication number 6 is going to be bladder control medication. Medications such as oxybutynin, tolterodonine, or sulfenacin are commonly prescribed for overactive bladder, urinary urgency, and incontinence, and those medications can provide important relief. But many of them are also block acetylcholine. Oxybutynin is especially important because it can enter the brain and may cause confusion, reduce attention, and the memory difficulties, particularly in the older adults. And this is what I see regularly for the last 26 years when I work with my patients. And one of the most common mistakes that you do regularly, you use a lot of those medications for many years, and of course you don't recognize early warning signs of dementia. Chemical medication number 3 is going to be older tricyclic antidepressants. Amitriptyline is the older antidepressant that is also frequently prescribed in a low dose for nerve pain, migraine, fibromyalgia, and insomnia. The dose may look small, but its anticholinergic activity can still be significant. Possible warning signs include dry mouth, constipation, difficulty urinating, blurred vision, daytime sedation, poor balance, slow thinking, and memory loss. Number 4 is going to be benzodiazepines. The group is include alprazolam, lorazepam, diazepam, and chlorpheniramine are similar medication used for anxiety, panic attacks, muscle spasm, seizures, or sleep. Benzodiazepines slow activity in the central nervous system, and they may provide rapid relief, but they can also impair the brain ability to form new memories. An older adult may become sleepy, unsteady, forgetful, emotionally flat, and confused. And long-acting drugs such as diazepam may remain in the body longer and can accumulate repeated doses. This is unbelievably important information. My next chemical medication that are connected with higher risk of dementia is going to be sleeping pills that begin with a letter Z. Zolpidem, zopiclone, and ezopiclone are often presented as modern alternatives to benzodiazepines. They are chemically different, but they act on related brain pathways and may produce similar problems. Next day drowsiness, memory gaps, confusion, poor circulation, falls, and unusual nighttime behavior. And so people have prepared food, walked outside, made telephone calls, or even drive while not fully awake, and remember nothing the next morning. The danger increases when those medicines are combined with alcohol, opioids, antihistamines, and benzodiazepines. Number 2 is going to be opioid pain medications like morphine, oxycodone, hydrocodone, fentanyl, codeine, and tramadol. For severe pain, cancer pain, post-operative pain, or palliative care, opioids may be necessary and compassionate treatments, but they can also cause sedation, slow reaction to the time, hallucination, and confusion. The danger is greater after dose increase during dehydration, with kidney or liver impairment, or when the opioid is combined with alcohol, benzodiazepines, benzodiazepines, sleeping pills, and sedative antihistamines. And number one reason why all those problems will be a lot worse, of course, is going to be using those kind of medications with any kind of knowledge or side effects, and especially if you use those kind of medications for the last years, a lot of them even daily. This is something I see regularly when I work with my patients. The most dangerous situation may not be the one pill, it may be 5 or 6 different medications working against the brain at the same time. Imagine an older person taking 3, 4, or 5 medication each day, like oxybutynin for the bladder, amitriptyline for the nerve pain, benzodiazepine for anxiety, and opioid after surgery. Different doctors may have prescribed each medication for reasonable purpose, but unless someone reviews the entire list, the combined effect may be missed. This is known as anticholinergic or sedative burden. One medication may cause only mild fog. Several together may produce severe memory loss, false hallucination, extreme sleepiness, or delirium that looks like rapidly progressed dementia. The National Institute of Aging specifically recommended reviewing prescription drugs over the counter products and supplements when the older person developing cognitive decline. And this is something that I see regularly for the last 26 years. Unfortunately, you come to my office and you seek my medical consultation from any part of the world, and you already use 5, 7, 9, or 10, 15 medication each day. Those medications are connected with the risk of dementia or Parkinson's disease. As I said it always, contact with your doctor or contact my MarioLab office, and we will make sure to give you every instruction, and especially in my office, we're going to give you alternatives, based natural remedies, and based MarioLab programs for these type problems like dementia or Alzheimer's. If you want to learn a lot more about best vitamins that really work perfectly with our brain, watch my video right here. Thank you for following my viewers. See you next time. Bye bye.